Hi guys, Dr. Rajarathna here. So this is one question that many of you are asking me. So I just thought I'll put it out before the NEET PG exam. So the question is, which of the following is not a peripheral retinal degeneration? So for that you need to understand what we call as the peripheral retina. So peripheral retina means near the ora serrata. So basically it is something between the equator of the eye and ora serrata. Alright, so let's quickly discuss what is equator of the eyeball. Equator of the eyeball is around the vortex veins. And what are vortex veins? Vortex veins are the veins of the choroid. So we have 4 vortex veins, and the equator of the eyeball is 14 millimeter from limbus. Alright, so you quickly got a lot of MCQs covered here, and let's go option by option. So lattice degeneration. So what is lattice degeneration? It is the most common retinal degeneration, very commonly found in myopes, normal myopes like you and me, and also in high myopes. All right. Now snail tract degeneration is again a peripheral retinal degeneration. All right. So you've seen these small snails, no? It looks as if the snails have walked, and lattice will look like matrix. Okay, so that's the lattice and snail track again. Now photoretinitis. Now photoretinitis affects the macula or the fovea. So that means you know what is the answer. So the answer is photoretinitis for this question. So what is the cause of photoretinitis? The cause of photoretinitis is exposure to infrared rays, typically by looking at sun. So we also call this as solar retinopathy or eclipse retinopathy, because it occurs when people look at the solar eclipse without protection. So infrared rays, that's important. Okay, now white without pressure. So when you're looking at the ora serrata, it looks a little white. Now that means you also have a white with pressure. White with pressure would be when you press on the sclera near the ora serrata, the retina will turn, or the ora serrata will turn white. So this is also a peripheral retinal degeneration. All right. So now I also want you to know another condition. What is that other condition? The term called photoophthalmia. Okay, so what is the difference between photoretinitis and photoophthalmia? Photoophthalmia is also called as snow blindness. That means the light that gets reflected from the snow is going to affect the eye. Now this is because of UV. All right. So here you will have corneal burns or corneal epithelial defects. So it doesn't really affect the retina. So photoophthalmia, two differences. What is number one? The causative rays, electromagnetic radiation, is ultraviolet, and it affects the cornea and conjunctiva, okay, the superficial parts of the eye. Whereas when we talk about photoretinitis, it affects the macula or the foveola, the central retina, and it is by infrared rays. Okay, bache, so there we go. So that is about a lot of things that we have learned because of this question. So thank you guys who shared this question with me. So we stop here, and I'll post some other question later.